A painful stye wasn't always treated as a germ or an infection. It was treated as an imbalance in the body's delicate harmony. In early medical writings, eyes were seen as windows fed by hidden forces, so when a red bump appeared on the lid, healers looked for what had gone out of balance. Too much heat, too much bitter humors, or a blocked flow that could not settle properly. Picture the treatment room. A small bowl, a cloth warmed until it steams gently, and a careful hand pressing it against the eye as if calming a fever. Around it, herbs are shown being warmed and steeped, simple, visible ingredients, then laid in the cloth to bring relief by softening this stubborn matter believed to gather near the surface. No rush of modern tools, just deliberate heat and patience. Then comes the part that surprises people. Along with warmth, some traditions added symbolic care, marking the skin with clean, meaningful touches or using prescribed gestures meant to guide the body back toward balance. The logic is gradual and eerie in its calm confidence. First soothe the eye, then nudge the humors into order, and finally watch the bump fade as harmony returns. Stay with it. What looks like a simple sore lid becomes a story about how early medicine explained the body, one visible sign at a time. Why Styes worried people in early medicine. Styes concerned early healers because the swelling at the lid was treated as more than a local nuisance. It looked like a sign that something within the body had turned hot or stuck, and the eye, so closely tied to sight and nerves of feeling, was seen as especially sensitive to that imbalance. Instead of asking what germ might have entered the eyelid, practitioners often asked what mixture of humors or qualities had tipped out of order. Many early medical thinkers used balance theories to explain visible problems. A lid that puffed up and grew sore could be read as heat collecting where it shouldn't, or as thicker, heavier material gathering near the surface. Tears and blinking were watched like clues, too, because the eye was understood to respond to the body's internal state. When discomfort flared, the worry was not only pain, but also the fear that the body's constitution had slipped toward a hotter, harsher condition. Remedies followed that logic, and they were meant to guide the body back toward steadiness rather than to kill anything. Warming compresses appeared in many traditions, often applied with cloths soaked in comforting plant infusions, because warmth was considered a way to soften and coax whatever was causing the blockage to move again. Healers might pair that with gentle massage around the lid, done carefully, in their telling, so the affected area could drain without tearing. Some accounts also describe careful cleanliness, not to disinfect like modern medicine, but to remove excess grime and calm irritation so the busy heat would not keep flaring. Other symbolic actions were used alongside the physical ones, reflecting how early medicine believed signs had meanings. A practitioner could offer an herb bundle or a small cloth charm to be held near the eye while the compress warmed, treating the ritual as a helpful signal to the body's regulating forces. In some settings, eyes were approached with contrary treatments when the swelling seemed too fiery. Cooling washes made from mild plant materials could be selected when the lid ran red and angry, while warm measures were chosen when the problem was described as tight, stubborn, or thick. The treatment thus changed as the symptoms changed, guided by a simple observation. When it looked hot, it might need to be moderated. When it looked stuck, it might need to be warmed into release. Even the choice to avoid aggressive handling could be tied to those beliefs. Early instructions often emphasized that squeezing could push the problem inward or worsen the body's imbalance, so the safer goal was coaxing and calming rather than forcing. People feared scarring and loss of clear sight, so the logic became protective. Return balance gently, keep the eye's surface clear, and let the body's hidden order reassert itself. That is why an eye stye could worry a household long before modern explanations existed, because it was treated as a visible argument between qualities inside the body, and everyone wanted the debate to end. The strange remedies doctors used for eye styes. Old medical writers treated a stye less like a localized gunk problem, and more like a sign that the body's balance had tipped. They described the eyelid as a place where unseen humors could gather, harden, and then show themselves as a tender bump. Many doctors looked for the deeper cause first: diet, rest, mood, and the condition of the rest of the body, rather than assuming the lid was simply infected. That way of thinking shaped the remedies they offered, and it often surprised people who expected something aimed at germs. Warmth was one of the most common first steps because it fit their idea that the bump needed to soften and open. A careful attendant might soak cloth in warm water, wring it out, and lay it gently over the closed eye, repeating as it cooled. In some households, herbs were added to the warmth in simple, visible ways. A small cloth pouch filled with dried, aromatic leaves could be warmed near heat, then held against the lid. The goal was not a precise chemical effect. It was a practical nudge toward loosening and release, guided by the belief that heat helped bring trapped material to the surface. Doctors also relied on symbolism and bodily signs when they judged what to do next. If the redness looked hot, they favored cooling adjustments, sometimes suggesting gentler rinses with mild, soothing liquids and advising foods believed to calm the hot qualities. If the swelling seemed stubborn, they might increase the attention to softening measures, emphasizing repeated warmth and rest. Some remedies used oils or salves applied sparingly at the lash line, chosen less for their antibacterial power and more because oils were thought to carry balancing properties and keep the area from drying and tightening. Bleeding and purging appear in older records as well, reflecting the belief that excess or imbalance had to be removed from the system. Practitioners sometimes recommended letting the patient relieve what they considered too much of the wrong humor, or using controlled evacuations through diet or herbal preparations. The eye, in their logic, was a billboard for what was happening inside. That is why a child's stressed sleep or a person's heavy meals could be discussed alongside the eyelid bump, and why a remedy might shift depending on the patient's overall condition. Even the act of waiting could be part of the treatment plan. If a stye looked ready to resolve, some instructions focused on staying gentle and avoiding harsh rubbing, since the body was expected to correct itself once balance was restored. Cold compresses might be favored when the eyelid looked angry and swollen, while warmth and careful herbal pouches might return when tenderness suggested the bump was still thick and needful of softening. In that historical framework, the strangest part is not only the tools, cloth, herbs, oils, cooling washes, or dramatic internal measures, but the reasoning behind them. The lid was not treated as an isolated problem, but as a clue to the body's shifting harmony. Did these treatments actually help? In early medicine, a stye wasn't usually treated as a simple germ problem. Many healers explained it through imbalance, warmth trapped under the skin, an excess of something rough in the body, or a failure of smooth flow between the body's parts. The eye was treated as part of the living balance system, so the goal was to nudge that balance back into place rather than only clean out one spot. Remedies often began with visible, practical steps aimed at softening and calming. A warm compress would be applied over the eyelid, sometimes cloth soaked in warm water, and sometimes herbal infusions meant to open what had gathered. People might wrap small bundles of dried herbs in clean cloth and let the heat settle against the eye for a time, then remove it and repeat. This was meant to encourage the lump to soften and the discomfort to ease, guided by the belief that the body's own forces could then resolve the problem. Some treatments also used symbols and targeted rituals, not because the eye was thought to be mystical, but because the body was understood to respond to signs. A healer might lightly press along the eyelid in a controlled way, emphasizing gentleness so the burden didn't worsen. Others used specific gestures, tracing a short pattern near the brow or repeating a phrase while the compress worked, because calm attention and steady procedure were seen as part of restoring correct order inside the body. Even simple actions, like keeping the eye protected from dust and wind, fit the same logic. If the body was already out of balance, irritation could feed the imbalance. What surprises modern readers is how much the help came from the treatment environment rather than from cutting anything open. Warming the area can reduce discomfort and swelling in many skin and soft tissue problems, and it can help a blocked pore or inflamed spot settle, no matter what explanation was used. Herbal compresses, when used safely and without harsh ingredients near the eye, would also provide warmth and moisture, which can feel soothing and may encourage natural drainage. In that sense, the old reasoning about trapped warmth aligns loosely with what warmth can do, even though the cause was described in balance terms rather than infection terms. By the end of these early care routines, healers often expected change in phases. first a calmer sensation, then less tenderness, and finally a gradual settling of the lump. A repeated pattern mattered. Compresses were brought back again and again. The eyelid was left alone otherwise, and the person was advised to avoid additional strain because aggravation was thought to thicken the underlying tangle. The most persuasive sign of treatment success, in historical accounts, wasn't lab evidence. It was whether the area stopped feeling tight, whether swelling relaxed, and whether the eye looked less inflamed. Still, the question, did these treatments actually help, lands most clearly on what could be observed. Warm compresses with careful handling could visibly reduce irritation and swelling, and that effect would be noticed quickly. The symbolic and balance-focused pieces, attention, protection from irritants, gentle external methods, could also support recovery by reducing further stress to the area. Even when the explanation was different from what modern people expect, the practical approach of warmth, protection, and patience could plausibly make a stye feel better and give it time to resolve. Even in old medicine, a stye wasn't treated as a simple germ problem. It was seen as a sign of imbalance, hot or thick, bad matter pressing toward the eye, drawn there by the body's shifting balance of heat, cold, and humors. The surprise wasn't that people were careless. It was that their remedies followed a different logic, slowly, gently, and in tune with what their bodies were believed to be telling them. In the final moments of the video, a cloth warmed with simple herbs is pressed close to the eyelid, as if inviting the hidden heat to soften and move away. Steam drifts upward in calm, visible waves. Then comes a symbolic ritual. A healer checks the skin, watches for the signs of readiness, and marks the timing with patience, because the treatment is meant to help the body correct itself, not to force the eye open. Small, clear steps follow. Warmth first, then careful cleansing, then a return to balance through rest and steady, measured living. You can almost feel the reasoning settle in. Warmth as cooling in disguise, herbs as guides for the body to set things right, and balance as the real center of the cure. And if you're looking at it with fresh curiosity, you're exactly who this story is for. Like this video if you want more medical surprises from the past. Next, we'll look at another everyday eye complaint and how early healers used the same body balance ideas to explain what they saw and what they did about it.